Hi, it's Bill, the Knee Pain Guru. Welcome to Monday, December 16th, 2019. Today we're going to talk about, so you got your Bakers Cyst drained and it came back. Now what? Okay, we're live. And this topic came out of a rash, an outbreak, if you will, of Bakers Cyst questions that I've gotten over the past probably week, just a number of different Bakers Cyst questions, so I thought I would address it. Hello there, Jimmy. How you doing? Okay, make sure to give the video a thumbs up, like, and subscribe to my channel, and turn on notifications. There's a little bell in the corner of the video for future videos. I think what we're going to do, the videos are on Mondays and Thursdays. Moving forward, I'm probably going to do them not at a set time because, well, my schedule isn't allowing for that. So we're just going to make sure you turn on the notifications so you become aware of when the videos do go live. So now we're going to go into, so you got a Bakers Cyst drained and it came back. Now what? Well, let's get a Bakers Cyst defined. So I went to the mayoclinic.org website and got this definition of a Bakers Cyst. A Bakers Cyst is a fluid-filled cyst that bulges and with a feeling of tightness behind the knee. The pain can get worse when you're fully flexed or fully extended when you're active. Bakers Cyst, also called popliteal cysts, is usually the result of a problem with your joint, such as arthritis or cartilage tear. Both conditions can cause your knee to produce too much fluid, which can lead to a Bakers Cyst. Although Bakers Cyst may cause swelling and make you uncomfortable, treating the probable underlying problem usually provides relief. So I got some questions about this. Whenever I read a lot of the conventional medical model stuff, there's just questions. It's almost like they avoid answering the actual issue. Like, how can your knee produce too much fluid? Like, what happens? Your knee has fluid and it's either able to drain it or it isn't. So producing too much fluid doesn't seem to follow a logical thought process. At least that's what goes in my mind. Arthritis or a cartilage tear. Lots of people have arthritis and cartilage tears, but they don't have Bakers Cysts. So why? It doesn't make sense. There's disconnects for me in terms of just a definition or an explanation of what a Bakers Cyst is. So we got that. Now we're going to look at the medical model treatment of it, which is sometimes Bakers Cysts will disappear on their own, which is what your body's supposed to do. However, if the cyst is large and causes pain, your doctor may recommend the following treatments. Medication. Your doctor may inject corticosteroid medications such as cortisone into your knee to reduce inflammation. This may relieve pain, but doesn't always prevent recurrence of the cyst. Then you have fluid drainage. Your doctor may drain the fluid from the knee joint using a needle. This is called needle aspiration and is often performed under ultrasound guidance. And there's also physical therapy, which includes icing, compression wrap. Crutches may help reduce pain and swelling. Gentle range of motion and strengthening exercises for the muscles around your knee may also help reduce your symptoms and preserve knee function. If possible, doctors treat the underlying cause of the cyst. If your doctor determines that a cartilage tear is causing the overproduction of synovial fluid, he or she may recommend surgery to remove or repair the torn cartilage. Bakers Cysts associated with osteoarthritis usually improve with treatment of the arthritis. Surgical intervention is rarely needed, and which is also the other option for the Bakers Cyst, is they would actually go in and remove the cyst, which is where the pressure is forming in there. So when I read this, occurs as a very sterile and surface level understanding of what's going on in the body. Your body has the infinite capacity to heal itself, which is why they will say here sometimes the Bakers cysts disappear on their own. Well, what is the difference between a Bakers cyst that disappears on their own and a Bakers cyst that doesn't? There's something going on in the body that is not allowing the Bakers cyst to resolve on its own. So the doctors can go in there with the medication and the fluid drainage, and you do the physical therapy. They possibly could even remove the cyst, but it's not necessarily addressing the underlying pattern that is causing the tension in the knee that doesn't allow the fluid that is built up as a result of arthritis or a cartilage tear that is preventing the knee from draining itself. Structure governs function. That's the tenets of osteopathy. Structure governs function. So if the knee is not aligned in a correct way, and I'm not talking about the knee is out of joint, or I'm not talking about that you can actually see anything on an X-ray, a CT scan, or an MRI, the knee would look normal. The knee would look fine. There's nothing wrong. You would not have any other diagnosis except for the Bakers cyst being formed in the back of the knee. The bones aren't lined up correctly. The tension in the joint doesn't feel right. It'll feel tight. It'll feel thick. You'll have a laundry list of different words that you would use to describe the knee. When a Bakers cyst is forming, when we have this tension pattern that exists in the knee, what happens is the synovial fluid and all of the other fluid that is supposed to move through the joint can't drain on its own. You'll have pressure build up. And I use the analogy many times of a garden hose. You have the garden hose, and you have the garden hose turned on. You're trying to pull it around the corner of the house. The hose gets kinked, and pressure will build up on one end of the kink, and the other end, there won't be any water coming out. This is a very similar understanding of what's going on in the knee when we have a Bakers cyst. That there is a tension pattern that exists within the joint caused by stress, tension, injuries, accidents, traumas, surgeries, whatever it is, whatever's happened to your knee is causing a certain tension pattern that the fluid, whatever is in the cyst, isn't able to drain itself. So by beginning to address the tension pattern in the knee joint, also in the hips and lower back, because the pelvis is the pump for the entire lymphatic system, you essentially release the tension in the knee, the lymphatic system will be able to drain itself. Much like when you go back around the corner of the house and you make the loop in the garden hose again, now the water can rush out of the end of the hose. This is not rocket science. This is not complicated. This is about creating comfort in the knee, changing the neurology in your nervous system, going from a sympathetic, which is a fight or flight state, to a parasympathetic, rested and relaxed state. And it sets up the conditions, once again, structure governs function, that your neurology is able to heal itself. The body is able to heal itself. And if it's not healing itself, there's something in the way preventing it from doing so. So we're just looking at, from basic logical understanding of what's going on in the body, that we relax the tension that's going on that's causing your knee to tense up and squeeze and make it difficult for that synovial fluid to move through your knee easily. Now we're relaxing it to allow the body to reestablish what it knows how to do, which is heal itself, heal the knee. So if you got questions, put those in over there. Jimmy already started, which is good. We'll get to those in just a moment. Make sure to give the video a thumbs up, like and subscribe to my channel, The Knee Pain Guru, as well as turn on notifications for future videos. It's a simple concept. It's not necessarily easy. because of the mindset that people get in, thinking that, well, we got to exercise the leg, I got to use it or lose it, and all that kind of stuff that kind of puts you like a hamster on a wheel. They get you stuck in that place. Makes you work really hard, puts you in pain, causes the tension and stress to build up in the neurology, which is actually working against what your body is trying to do in terms of the resolution of the Bakers cyst. If you want more information, because a lot of people watch these videos are like, Bill, what do I do? Go to my website, get on my newsletter, get into one of my programs. Begin with the comfort zone. I have other progressive where I work with clients to help them get out of pain, like real solid stuff you could do. You could implement like while you're sitting there on the couch watching this video going, but I don't know what to do to get out of pain. I'll show you how to do it. Okay, Jimmy has some questions. My daughter has a Bakers cyst behind the knee from a trampoline accident. Sure. It's not really a question, it's a comment. Thanks for sharing. I mean, if you have questions, ask, want a solution. We have solutions. It's just the point of, you're looking at a girl from a trampoline accident, the landing funny, stepping funny, twisting on a curb. What ends up happening is the joint. Most people understand that the knee joint extends and bends. Ask any doctor or physical therapist. And that's strictly what they're learning or looking at when they're trying to resolve an issue. They're trying to strengthen the quads, the calves, the hamstrings in the leg. Leg extensions, leg raises, leg curls, calf raises. From a basic understanding. But there's intrinsic movement of the knee joint. There's slight twisting. There's slight side to side. There's slight forward and back. There's slight apart and together. And there's slight tilting. When the body switches neurological states, when we have an injury, the body grabs on to that experience of the pain in the moment of the pain. And it holds on to that tension pattern. And what ends up happening is we continue to walk and move. We get on crutches for a little while, but the pattern is still stuck in the neurology. So now you try to go walk, you try to move, and it doesn't feel quite right. It doesn't feel normal. It doesn't feel like it used to. And that's because these tension patterns build up in the neurology over your lifetime. And this creates this pattern of injury compensation, where we lose mobility and function of the joint. So you go to the doctor and you say, well, I want to get this issue repaired. And the doctor will say prescription drugs, pain-killing shots, exploratory surgery, possibly painful physical therapy. So you go down that path, but it's all about getting the knee mechanically sound. And a lot of times people will have normal looking knees. Everything will be fine. They won't have a diagnosis, or they've had surgery and they've had whatever was going on repaired, but they still have pain. The knee still doesn't feel right. It swells, it's achy. And you'll hear, like I heard from Dr. Ellis, well, that's all we can do. You'll just have to live with it. Your knee is fine. And it's this dysfunctional neurological pattern that's going on in the joint that's not going to show up on an X-ray, a CT scan, or an MRI. So what happens? That tension pattern squeezes and holds on in the joint, begins to wear the joint. Now you get more pain. You go to the doctor. What does the doctor say? Well, you got beginnings of arthritis. That's normal because you're in your 30s, your 40s, your 50s, your 60s, your 70s. You name it. It's normal because everyone is limping around or hobbling around with these dysfunctional patterns in their joints, causing the joint to dehydrate, causing the joint to wear. And over time, that joint wears further and gets more painful and more stiff. And then you're a perfect candidate for a knee replacement surgery. And you need to hold off long enough until you're old enough so they only have to replace the joint once. They're hoping, because the joints only last 15 to 20 years. They're rated for 15 to 20 years. So they want you to be in pain long enough so they could replace the joint so you die and them not having to wear out the joint again and do a second knee replacement on there. It's like I'm just sitting back and going, this is the pattern that's going on. Okay, you're 100% correct about the neurology. My orthopedic doctor describes this in the same way. And you know what, Jimmy? I'd still be right even if your orthopedic doctor didn't describe it this way. This is how the body works. The main purpose of this channel is to get people to think in a different way and understand their body in a different way. And the way people believe the body works is what gets them stuck and in this on this hamster wheel of doing these things that just continue to create more pain and more frustration and exhaust the person because they're frustrated and angry. It's like, I want to live my busy life. I have my busy life and I don't have time for this knee pain. You fix the neurological problem through comfort. Comfort, your neurology has the ability to fire at 286 miles per hour. That's what it does. Scientists have tested reflexes. And from a baseline, some people, you get Olympic level athletes, they fire a little bit faster. Other people, as they age, you may fire a little slower. It depends on hydration and a lot of other factors. But from a baseline, 286 miles per hour, the neurology fires. Just like when the doctor taps your knee with a hammer, your knee jumps, you can't control it. You work with the intrinsic movement of the joint and create comfort in there, and you let the neurology do the work for you. Instead of you doing leg extensions, leg curls, leg raises, calf raises, working harder, thinking that someday magically your knee's going to be out of pain, we create comfort right now at this moment and let your neurology reorganize around that comfort. Does that make sense? Okay. D, did that answer your question? You want to know more? It's like I could only show so much, like right here, explaining it. This is about changing your mindset and understanding of how the body heals. You can go to my website, get on my newsletter list, sign up for one of my programs to get the how-to, to get what happens on the other side of creating comfort. Because there's a lot of things that can happen. Does it change? What do you notice? Your awareness is key in this process. And especially with someone that's been in pain for an extended period of time, there's a lack of understanding or more of an ability to remember what comfort feels like. So the brain continually looks for, well, where does it hurt? And where does it hurt? And where does it hurt? So it doesn't do you a whole lot of good to me to give you the answers right here, right now, because what do you do with it? It's like me throwing the keys to a brand new Corvette to a 16-year-old that just got their learner's permit. They're gonna wrap the car around a tree because it's too much power. Your neurology, your body's ability to heal itself is incredibly powerful. So what happens if you create comfort and now pain moves somewhere else? What do you do? What if you create comfort here and then the pain comes back 10, 15 minutes later? We need to know what to do. There's a lot to this process. It's simple, not necessarily easy. Okay, D, Get on my newsletter list. That's the best thing I could tell you at this point. You create comfort by working with the intrinsic movement in the joint. Okay, Life with Jimmy. Question: what do you think of all those glucosamine tablets and things that they're promoting out there to build cartilage? Do they really work? Jimmy, I can't really say if they work, and here's the reason why. If you have this neurological pattern that is causing the joint to wear, so you have this tension pattern, excuse me, you have a tension pattern in the joint. The joint is squeezing tight, causing rubbing and irritation of the nerves in the knee. Diagnosed as arthritis, all diagnosis of arthritis is dehydrated joint. So there's not enough lubrication and there's not enough space in the joint for the joint to lubricate itself. Meaning you could drink water all day long, but because of the tension that's going on in the joint, the water can't actually get into the joint. So if we can't even get water into the joint because the joint is squeezing too tight, like look at my hand here. If I squeeze the hand real tight here for a couple of seconds and then open it up, you'll see the hand white and then turn pink. It'll change colors just because of the tension in the hand. You hold your hand tight enough, long enough, your hand's going to be pretty tight and achy. Same thing happens in your knee. Same thing happens in the body when it becomes dehydrated. So now you have this condition of dehydrated joint. There's wearing of the joint. There's not enough lubrication in the joint. That in and of itself right there is going to make it extremely difficult if you take any sort of glucosamine, chondroitin, MSM tablets to help rebuild cartilage and meniscus in the joint if the joint is too tight to even get water in there. You see how there's layers and levels to this game? And it is a game. It's understanding how the body works. We have to set up the conditions initially, which is creating comfort in the joint, and then begin to set up the conditions so the body has the resources it needs to heal what's going on in the knee. Now, if you have extra money and you want to spend it on supplements at that point when the joint is comfortable, then great. There's also bone broth recipes on my website, which is the same stuff that goes in, the stuff that is in bone broth can help give the body the resources it needs to heal itself. So we have to look at it. We have to unplug from everything we've been told and look at it from a logical, common sense, calm place. Because when you're frantic about getting the knee out of pain and you're trying to think at all these options and you're going to see a doctor and the doctor is telling you this and the physical therapist is telling you this, but you're not seeing the results in your knee, well, then you got to take a step back. At that point, doubling your efforts, doing things that isn't working, that you can't see any changes or results or explanation as to why it's happening, isn't going to get you out of pain any faster, isn't going to increase range of motion or break down scar tissue or get a Bakers Cyst to resolve itself. Have to take a step back. We have to look at what makes sense. What is the only reason you're watching this video? Is because you have pain. You have some sort of experience in your knee that you don't like. So we have to begin with resolving that experience and get it to change to something else. We have to be present to what's going on in the knee and in the body right now to shift those neurological states to get you moving to a place where the body is able to heal. And once again, Jimmy, bone broth is good. However, if we don't have the space in the joint, then you're just drinking bone broth. You're not using it in the context of a larger strategy. And that's what's important to understand, and why so many people suffering with knee pain and continue to suffer with knee pain don't get the results they want, is because they're piecemealing the strategy. they're using a little bit here and a little bit there and a little bit there. And then it's like, well, it didn't work. I'll scrap it all and I'm going to start again. I'll go with something else. I'll try stem cells or PRP, or I'll try supplements or something like that. It's like taking a bunch of stuff and throwing it against the wall and seeing what sticks. And we're smarter than that. There's a better strategy than that. That's what I teach clients. That's what I work with, to plug it into a larger strategy, to take what's going on in your busy life and seeing how we can apply it to what's going on. Do you stand at work? Do you sit at work? Do you walk all day long? Do you drive a vehicle? All of those have different tension patterns. Do you have kids or not? Are you a grandparent? Are you active? Are you more, you sit at home more? These are all factors that need to be taken into consideration to look at what's going on to make the program work for you, which includes, Bakers Cysts, or you've had a knee replacement surgery, or you just have knee pain, or whatever, chondromalacia or tendinitis or tendinosis or arthritis or osteoarthritis, whatever it is. The diagnosis doesn't matter. These principles apply no matter what your situation is. So, okay, give the video a thumbs up, like and subscribe to my channel, The Knee Pain Guru, as well as turn on notifications for future videos. We do these on Mondays and Thursdays and go over different topics that are sent in based on what's coming in through the YouTube channel or through my website, whatever the situation is. Okay. Don't see any more questions. If you would like, put those in. They need to come in pretty quick. We're going to wrap it up. I'm going to scoot, and I got some calls here. People that have signed up for my Knee Club on-ramp, which would be a real good place for you to start. It's where we work for 2 weeks and begin to get you some tangible results to get out of pain and work with. And at that point, if it makes more sense, how do I get the newsletter? TheKneePainGuru.com. I'll drop let me drop the website here. It's also in the description. TheKneePainGuru.com. You can go there, sign up to get on the newsletter list. It's the Insight newsletter. I send out daily emails. It's all about changing your mind. It's not all in your mind. This is really important. When I hear clients say, well, the doctor told me, or the physical therapist told me, it's all in my mind, I got to push through the pain. It's not. Your mind plays a huge role as far as what's going on to get you out of pain. And it's keeping a positive mindset and focusing on the right things. The pain you're actually feeling is in your knee. And the disconnect is when people think, well, if I just think positive thoughts, my knee pain's going to go away. It probably won't. Because we also need to give the physical body evidence and proof to reinforce the belief that you're having a positive mindset, that it is going away. So we have to ping pong back and forth between creating comfort in the physical body as well as shifting the mindset to look at where the opportunity is, the comfort is. What information can we use from the experience of pain to our advantage, so your body can continue to heal and recover and improve? So it's important. It's not just thinking positive thoughts, because that gets a lot of people stuck. Okay. Bill Paravano, the Knee Pain Guru, going to sign off for today. Have a wonderful day, and I'll see you on the next video.